you're up.
Hi students, welcome to Nursing 90, welcome to Cypress College, and welcome to our nursing program. My heart goes out to all of you, and I'm so excited that you're here and advancing your careers and your commitment to nursing. And so now we're going to get into the topic of nursing care plans, which seems to be one of those things most students don't like to do, and probably a lot of teachers don't like to read. But it's important because it teaches critical thinking and it helps us to think like a nurse, so we can rescue patients and we can take care of them and get them to their optimal health level. All right, so I want to go over the components of what we do at Cypress College, and I want you to look at the 192 care plan that I posted. And on the very first sheet, our front page will be your running head. This is APA format. And you're just going to have your nursing care plan, your wonderful name, Cypress College, Department of Nursing, your class, Nurse 90, and then your clinical instructor and the date submitted. That is your very first page. And a lot of people sometimes will even put their name here, but you don't have to. Every page should have a number on it according to APA. All right, then so with this care plan, you are going to be submitting your SBAR form with your nursing care plan document. When we go to the hospitals, sometimes students get a lot of information from the EMR, and we cannot take anything out of the hospital because that is a HIPAA violation. And I know that you know that because of your past experiences. All right, so that's page 1. And so now we're going to talk about page 2 and 3 on this particular set. So if you notice, this is in a Word document table, maybe even in Excel, and this will be included in your paperwork online. And basically, it's kind of a synopsis or maybe even a story about the patient that you took care of. So the patient that we're going to be discussing today, her initials were DW. She is an 82-year-old female, and she's a retired school teacher. She was well educated, had a master's degree in education. She was admitted to the hospital on March 22, 2017, and her admitting diagnosis was diarrhea, rule out gastroenteritis. You have this form, so don't worry if you can't see it too well. When we asked her about her health history, she said that she'd had a hysterectomy in 1990, a cholecystectomy in 2005, a right hip replacement in 2015, and she also had had pneumonia last year in August. She has a history of hypertension, hyperlipidemia. She has no known drug allergies, and she's a full code. Okay, and then when we get to the summary of her hospitalization, she was brought by to the emergency room by her daughter with profuse liquid stools at home. For 1 day, stomach was cramping and she had a lot of fever, etc. She had a temperature, her stool tested positive for C. diff, and she was placed on contact isolation and admitted to the hospital. They started the antibiotics and probiotics in the hospital, and she still continues to have large amounts of liquid stools since admission, and the fever and cramping have improved. Then we have a section for abnormal labs, and she has some significant abnormal labs. Her abnormal labs, white blood cell count 22,000. That is very high. We definitely know an infection is happening. And then her electrolytes, potassium is very low of 3, and her sodium is 133. When I talk next week to you about a care plan and when we do fluid and electrolytes, we'll concentrate on these. We might even use this case study and make it a 292 level. Okay, current medications, she's on vancomycin for infection, and probiotics, and Percocet for pain and diarrhea. Then talks about her family system, family support system, like people who are here. This is very important when you are assessing elderly patients. Do they have a place to go? Who takes care of them? As we get older, it gets harder to do some of our ADLs, and we want to make sure our elderly patients are getting the care they need. All right. And then we talk about the discharge plans. That's why it's so important to find out who's taking care of her. All right, so she's going to plan to go home, and we're going to have more in hand washing, and we're maybe going to get her a bedside commode if she goes home, if she's still having liquid stools. Okay, and on the back of that sheet is a little more information. Okay, so you're going to make that story believable and complete, and just like you would be taking care of your mom or somebody you loved, you want them to make sure that you're getting the full story so you can make recommendations to discharge planning or their family to find out what type of resources they need. Okay, so give me a second here, and now we're going to talk about assessment, and this starts on page 4. So assessment data is very, very critical. This is probably the #1 piece of information, or lots of information that you need to make a successful care plan. Okay, the more data you have, the better your care plan will be. Okay, so subjective data. What does subjective mean? It's not factual. It's not a lab value. So she has 5 here. She says, my stomach is cramping. That's a symptom of what she's saying. It is not necessarily a fact. Okay, the pain in my stomach is 6. So you can read those. I'm really anxious about being in this isolation room. Okay, then objective data. Very important to put your pieces of data in the right category. So objective data. Hyperactive bowel sounds. Objective data is something I can see. No nail polish. Okay? Large amounts of liquid stool in the last 8 to 12 hours. This could have been enhanced by talking about what the color looked like. Temperature. And in my world, because I'm a second-year teacher, we would have all the vital signs here for her. And then the stool positive is cool. That's perfect. And I would also put the labs that are abnormal there because I want to start clustering my data. So things that go together. And we'll talk more about that next week. Okay. She is on contact isolation, and she's on probiotics, vancomycin, Percocet. Those would be all together under a separate category called medications as we move forward. And then perennial skin is intact. That's very important for a patient that has diarrhea, especially when they're 82. Okay, and then her labs, and then the fluids that they're giving. So some of these you could say are interventions more than objective data, but for a 192 student, this is an incredibly good piece of work. Okay, so after evaluating the data and taking care of the patient, the student came up with the nursing NANDA diagnosis of diarrhea related to inflammation of the GI tract, secondary to C. diff, as evidenced by profuse liquid stools. And she threw in a couple other things. As we go through this program, we make those statements shorter and sweeter. We don't want every piece of your assessment data. We want a simple statement. So I could have shortened this to diarrhea related to inflammation of the GI tract, as evidenced by profuse liquid stool, period. So we're gonna work towards getting those shorter. Okay, all right, take a pause for 2 seconds. Okay, so let's go ahead and erase this. And now we need to talk about our goals. So we have a NANDA. And so what is our goal? Well, we want the patient to not have any more diarrhea, right? And so we're going to write this as the patient will have a decrease in diarrhea. Okay. Okay. That's our goal. Okay. And then we'll have AED as evidenced by, and in the first year we have you do 2 goals, but in second year we have you do 1 goal because we don't need goaluria. especially when we're talking about diarrhea. That was a joke. All right. So as evidenced by this student passage of a softer form stool, or the patient will have less than 3 stools. The second one, the problem with B is it doesn't say by when, and it doesn't give you a time frame, 12 hours, 2 hours. I personally like passage of a soft or form stool within 24 hours. Okay, and your target date is by the end of the shift. That's not what we do in the second year or as a nurse, because we want our plan to go on, because we developed a wonderful plan and we want the next group of staff members to follow that plan and to continue on with the plan. Okay, so if we're really good, we can get our plan done in 1 shift. That happens, and it's really exciting when it does, but it doesn't always happen. Okay, so then the nursing interventions, super important, and those are going to include assessments, management, education, discharges, referrals, all kinds of different things, okay? So the number one thing this student wrote was, I'm going to maintain contact isolation. And the student went on about that, and that's fine. And the more detail, the better, but you don't need to add extra. Then she talked about washing, and I said she, it could be a him. Wash hands. We know with C. diff, and then why we'll only wash hands, not just gel hands. We know with the bacteria C. diff that hand gel, alcohol gels do not remove the germs. Okay, and she wrote every time, and this was very specific, and it was very well done. Okay, and you can read all through the nursing interventions. She monitored the stools. Okay, she she taught the patient and had them return, demonstrate. She made sure all the visitors were informed to know that the isolation protocols were what they were, and demonstrated to them as well. She assessed every stool for what it looked like for consistencies, and she auscultated the bowel sounds every 4 hours, monitored the temperature every 4 hours. I think that she should do all of the vital signs, and monitoring vital signs is very much always a priority, and you want to include temp, blood pressure, respirations, and pulse. Okay, very important that we get all of those components. Auscultate the bowel sounds every 4 hours, and I would have put that together with assessing the stool. Those could have been one clustered intervention. That's an example of clustering. Okay, and then she said she's going to, or the student said, they are going to collaborate with their primary RN to administer C. diff antibiotic vancomycin as ordered. And you can go through all of these things. Now the next part about the intervention. So an intervention is something you are actively doing to make the patient better. The next thing, if you look in this column, we need what I would call a rationale. And a rationale is simply a rationale as to why am I doing that intervention. And you're going to be getting these from your med search textbook. Okay? And so for example, why do we monitor temperature every 4 hours? Because we know that this patient already had an infection, and we want to make sure that she doesn't get any septic. Okay? And we want to make sure she doesn't get further dehydrated. Okay? Why do we monitor labs? Because we want to replace potassium and sodium so that she doesn't go out of homeostasis. So that is what we call a rationale. Very important. Each intervention will have a rationale, and it'll be actually, you'll tell us where you got it from, what book. All of your rationale should be less than 5 years old, okay? And then you get to check out how effective, sorry about my writing, how effective was your intervention? Okay, so that means you're evaluating the intervention, rationale, effectiveness. So the purpose of reviewing and evaluating your effectiveness is someday when you're the RN, you can't do every single one of these things, and you want to be able to say, which one is the most priority? What if I didn't do that? What would happen to this patient? So you don't need a long list. You can say, I assessed, she wrote stools were all primarily liquid. So that means that the crisis has not changed, okay? And then she wrote the temps down. That's telling me what you did, but it's not saying whether or not it was effective. So instead of saying the stools, I would write stools were still primarily liquid, need to think about a different plan, because that's not the goal. The goal was to have formed stools. Okay, and then the student gave the vancomycin. You can just say that, yeah, ordered, and then you might have a peak and trough later. But those are things. So this is kind of a sticky one, and I would say a lot of the teachers do it a little different. But I'm looking for the effectiveness, not that you did it. How did they tolerate the vancomycin? Did the white blood cells go down because she had vancomycin? Those are the kind of things that mean that your medications or interventions were successful. Okay, and so then we get to the very last page. I'm not going to go through every page because I value your time, and you value mine as well, and I don't want to bore you. So the very last page is the evaluation of the expected outcome. And she did not meet. Patient continues to have loose stools. More time is needed to accomplish this goal, which is what I said in the beginning. By the end of the shift, she probably would not have that. So second year, that's where you're going. You're an experienced practitioner. We know that C. diff isn't going to go away in 12 hours. And then the second one, she wrote partially met. The patient had 5 loose stools. So that was a decrease. So we're going in the right direction. So what does that mean here? That means that we should continue this plan. Okay? Now there was a couple of key components in this care plan that for me kind of like, whoa, she missed the priority, or the student, maybe he missed the priority. Was the potassium, the sodium, and the white blood cells. All 3 of these at your level are going to have to be addressed much more than they were in this care plan. All right, so that's a wrap for today. I'll be seeing you next week, and we'll be doing a 292 care plan.